Hi everybody, welcome to our webinar about Altrua, which is a faith-based health plan that's available throughout the United States. My name is Leslie Jablonski, and I'm going to just take about 10 or 15 minutes today and give you an overview of what a faith-based health plan is and why we are seeing it as an excellent option to the Affordable Care Act, which is also known as Obamacare, and in this presentation I will refer to as ACA. So just to give you a quick overview, Altrua is one of about 5 faith-based plans that are offered in the United States today that have a religious exemption from Obamacare. The faith-based plans are not a new phenomenon. They have been around for about 30 years. They're becoming increasingly more popular in the last several years due to the advent of Obamacare and the rapidly rising premiums and out-of-pocket maximums that are associated with the ACA plans. To have the religious exemption that Altrua and some of the others have, they will have had to have been in business since before 1999. So these companies are well established and have a large number of clients already on their books. And we do have kind of a favorite. Altrua is the one that we are appointed with recently. We also are appointed with one called MediShare that probably has more name recognition. And then there are some others out there that you may have heard of, Liberty, I believe, and Samaritan. But like I mentioned, there are only about 5 nationally that are exempt from Obamacare. And today we're just going to focus on Altrua. Now, basically, one of the main reasons that people are leaning toward these faith-based plans is the price. So the faith-based plans are generally half as much as the ACA plans. And honestly, I've been looking at the 2017 rates coming across from the various states, and with the increases that I'm seeing, faith-based plans in a lot of cases are almost a third of what people are going to be paying if they were to pay full price on an ACA or Obamacare plan. Just to give you an example, a 40-year-old would pay approximately $240 a month for an Altrua faith-based plan that has a $1,000 deductible and $3,500 out of pocket. The same plan for a family of 4 with Altrua is only going to be about $492. I've run some comparisons, and a 40-year-old with a $3,500 out of pocket on an ACA plan is looking at closer to $700 to $800 and even more, depending on which state and county he lives in. And a family of 4, in some cases, are looking at upwards of $1,800 to $2,000 a month or more for this low of a deductible. Now, it's important to know that the Altrua plans, as is all of the faith-based health sharing ministry plans, they are not insurance. They're sharing ministries, and they're not subject to the ACA regulations or penalties. So if you decide to enroll in a faith-based plan, you are not subject to being penalized for not being enrolled in Obamacare. They have a religious exemption. And also, because of this religious exemption, they do get to make their own rules. There is no need to wait until open enrollment. With Altrua and MediShare, you can enroll anytime throughout the year. Now, one of the main requirements for becoming a member of Altrua is that you agree to their statement of standards. And if you agree to believing in these standards, then they will consider you for enrollment. The statement of standards are that you believe in caring for one another, you believe in keeping the body clean and healthy with proper nutrition, you believe the use of any form of tobacco, illicit drugs, and excessive alcohol consumption is harmful to the body and soul, you believe that according to the Word of God, sexual relations outside the bond of marriage is morally wrong, you believe that marriage is a bond between a man and a woman only, you believe that abortion is wrong except in a life-threatening situation to the mother, you believe that physical, mental, or emotional abuse of any kind to a family member or anyone else is morally wrong. So this is their statement of standards. Altrua does not require that you claim a specific faith or denomination to enroll in one of their plans. They just do require that you agree to their statement of standards. Now, Altrua, it has major differences from Affordable Care Act plans. Some of those differences are that they do conduct medical underwriting. Certain pre-existing conditions may cause a decline of coverage, or Altrua may decide to place a rider on a certain condition for a limited amount of time or perhaps even indefinitely. So placing a rider means they will not cover that pre-existing condition for a certain period of time. Also, preventative care is not free on Altrua. It is subject to a $35 office copay, though. So Altrua provides 6 copay office visits a year per person, and that $35 office copay would cover up to $300 of services and charges. Now, if your office visit exceeds the $300, then you would be responsible for paying the remainder. So for things like perhaps a mammogram that would cost more than $300, Altrua would give you their negotiated rate for that service. Another major difference from Altrua is that they do have a $1 million lifetime maximum benefit. The Affordable Care Act, as you know, has no lifetime maximum. So if you were to actually exceed your $1 million lifetime maximum benefit, you would have a special election period, or what the ACA calls a life event, to be able to switch back over to an ACA or Obamacare plan. Additionally, another thing that Altrua does is they do not offer coverage for mental or psychiatric problems. There is no mental service and no treatment for alcohol or drug abuse. Additionally, they do not cover cancer in the first 12 months. Now, just to give you a little more information on the cancer exclusion for the first 12 months, the way that this works with Altrua is that all members that are 40 years old and older must have a mammogram, a pap smear, or a PSA screening done every 2 years for any associated diseases or disorders of those areas to be covered. Now, when you first apply to Altrua, if you have a result from a recent pap smear, mammogram, or PSA screening that's no older than 6 months old, they will take that. However, if you don't, then within the first couple months of you being on their plan, they're going to encourage you to get a pap smear, mammogram if you're a woman, and or a PSA screening if you are a male. And you can use your $35 office copay to get that type of screening. And when you submit the results for those screenings to Altrua, that is when your 12-month clock starts ticking. After 12 months from that point, then cancer is covered. Now, if you should have a cancer diagnosis or need treatment for cancer in that 12-month period, they will work with you and still negotiate rates for you and help you get the best pricing on the services and the care that you need. Additionally, you can speak with your personal benefit consultant here at HSA for America and sign up for a cancer plan for a year that would cover you for any cancer that might happen during the time you're waiting. Now, Altrua does offer several different benefit options. They have a couple of different deductible levels and out-of-pocket maximums, and their terminology is different. They are not insurance like we mentioned earlier, so a deductible and an out-of-pocket maximum and co-insurance, these things are going to be called member responsibility amounts. So Altrua's member responsibility amounts, like we've already seen, are much lower than the Obamacare plans. In fact, in looking at the 2017 plan structures, I see that the out-of-pocket maximums can go as high as $7,150 per person. Altrua is available in all 50 states. And additionally, they have a national PPO network that is not restricted to the area in which you live. So, for instance, if you signed up for your plan in Texas, but you wanted to go see a doctor in Minnesota, all you do is search the website www.multiplan.com, search the PHCS network, and find that doctor in Minnesota, and you can certainly be still in network in Minnesota. It's a robust network, and I think that most people are going to find that there are a lot of doctor options in the PHCS network. Now, this was just a quick overview, but I would encourage you, if you want more information about Altrua or even MediShare, to talk with your personal benefit consultant. If you have their phone number or their email, just reach out to them and tell them you're interested in more information. Or if you have forgotten their contact information, just dial 800-913-0172 and get in touch with them that way. You can also sign up for one of these plans right on our website, which is hsaforamerica.com/Altrua-healthshare-plans.htm. I want to thank you for your attention today, and if there's anything we haven't covered, like I mentioned, please just reach out to me or any of your personal benefit consultants, and we'll be happy to answer any other questions that you have. Have a great day.